looking good has never been easier, especially with the help of our special guest tonight, the dynamic duo, Dr. Cara Criswell and Dr. Bryan Criswell. Welcome to the set tonight.
Thank you, Debra.
We're so excited to have you. Always get so many emails, and you're so well received in the community in Charlotte, world renowned, and we're so excited that you take time from your busy schedule to join us.
We love being here.
We do.
And answer all those great beauty questions. I have had several emails about the topic that we're going to talk about tonight, and it's about the aging neck. I'm sure you hear that a lot in your practice.
All the time.
So, you know, there's different variations of it. You know, some people have the turkey neck. Some people have the beginning of the crepiness in their décolleté, you know, and some people have a combination of both. I'm going to start with you, Dr. Cara. Tell us some ways to handle that or some procedures that might work.
Okay. Well, let's start with the crepiness because that can be dealt with least invasive options. One of the best ways is, of course, using sunscreen from a very early age, because really that is an area that you forget. You put the sunscreen on your face, you might put a little bit on your neck, but you forget all about your chest. And that can be an area that just gets the direct rays, and that can really show the crepiness. So you start with good skincare. So even using your Retin-A products, your hydroquinones, all of that you put on your face, carry it right down to your chest, because that delicate skin is very visible, and you don't want to look like you have great skin up here and not so great skin down here. Right. Another option is to use some chemical peels. So the chemical peels that you would use to resurface and rejuvenate your face, carry it down on your neck, carry it down on your chest, and that can really deal with that crepiness excellent and just really very, very well. And that's minimally invasive. Right.
One of the peels that we did actually at your office on TV was the blue peel. Is that something that would work for the décolleté area?
Absolutely, and that's why when we do it, we do carry it right down to the neck and the chest. So when we have the patients pre-treat with the Obagi skincare, we say, go right down to your breast, because we will be able to use that peel all the way down, and you see a significant improvement in the skin discoloration and that crepiness. Just skin quality itself is much improved after that.
Now, the average person really does adhere, probably not the average, probably very little of the average person adheres to all of those things, because we have the light bulb that comes on when we see the things happening to our bodies, the aging process. And so at that point, you can't go back and fix it. I mean, that's all great, and you know, a lot of people do that, especially more now than ever before. But, you know, once it's too late and, you know, we have seen the damage happen, what is another option for? I love the laser, because that really truly is a quick, easy fix.
Very, very good option.
It really is.
And there's several lasers out there that are great for the neck. One of which is Fraxel, and what that is that involves some CO2 lasering, but it's not continuous, so there's minimal downtime. There's also Thermage, which helps to tighten the underlying skin and tissues. And then one of the newest one is Excelis, and that really has minimal discomfort associated with it as well. So there are some great lasers out there to treat the lower face, neck, and chest.
I love that. There's so many laser options now. We're going to come back with another option that you're going to talk about in just a quick minute after we take this quick break.
It's fashion. It's beauty.
I personally believe that every single person can do something.
It's celebrity.
And then you were starring in Whitaker Bay.
Whitaker Bay, which was, of course, in North Carolina Beach.
It's fun.
Holy cow, I'm on the Debra Kennedy show. It doesn't get any bigger. It is huge.
Join us here on Saturday nights at 9:30 on Access 21 for the Debra Kennedy Show. Beauty from the inside out and the outside in.
As a mother, I understand the changes women's bodies go through with pregnancy.
Having children changes women's lives in many ways, including some they may not have foreseen. The Mommy Makeover eliminates sagging breasts, a flabby stomach, and stubborn pockets of fat.
The Mommy Makeover allows you to reclaim your pre-pregnancy body and look and feel great again. We complete the procedures in just one surgery. Expect the exceptional and regain your life. You deserve it.
We're back talking about the delicate area of the neck with our beauty experts, world-renowned surgeons, the Criswell team. You were talking about all the lasers, and Dr. Bryan, what is another option when our patients feel like really it's gone too far and laser might not deliver the results they want?
Well, I think like most people, we don't pay enough attention early on to using sunscreen, avoiding the sun, and so we all end up with damage to our neck and the décolleté. And if you've tried the non-invasives, the lasers, the chemical peels, or if you haven't, you've just had too much damage, really the next step is a more comprehensive treatment with neck lift, so surgery. We like to combine our neck lift procedures with a rejuvenation or a resurfacing at the same time. So we'll combine our neck lift surgery procedure with a resurfacing, with a peel at the same time, so that our neck lift will tighten the skin of the neck, which gives a better contour of the jawline, the chin, and smooths the skin out of the neck. It actually pulls the skin tight, much as if you look in the mirror and pull your own skin tight. That's really what a neck lift does.
Okay.
And at the same time, resurface from here down so that you get that rejuvenated skin all the way down from your chin all the way down to your décolleté area.
Right, I love that because sometimes in the morning in the mirrors, you'll have your little hand mirror and you'll lift it all up and you think, oh, that's what I could look like if I just had that neck lift done.
That's exactly right. And I'll tell people when my patients come in, they say, I don't really like this. I say, well, pull on your neck like I know you're doing at home. And they laugh. And that's what
we are.
We do. And we pull on our neck and we look in the mirror. And that is really what a neck lift does.
Right.
It is a surgical procedure, so you do go to sleep for the procedure. There is some downtime with it. You need about a week or two of healing. So you have about a week where you're out of commission. You can't really be out in public.
Right.
And then the second week, you can cover any bruising with some makeup. And then after that, you're pretty much recovered.
Right, and I love that you gave us two options. One is prevention. Actually, three options. The first is prevention, which is great sunscreen, great skincare routine, and then you might not have to worry about this as quickly as some of the others. Then, if it's already too late, we've got the lasers and the different options that you had with that, and then also the peels. And then if that's not really right for the patient, then we have got the surgical neck lift. So thank you so much for all of your wealth of information. And it's really about talking to the individual person, our viewers out there, and your patients to find out which one of those methods really would be the perfect fit for that person.
That's right.
So thank you for giving us the very few, or very not limited, but endless options so that they can really get the right fit. So thank you for spending time with us tonight.
Thank you.
You're welcome.
And we hope you have enjoyed this segment with the dynamic duo, the Criswell team.